Hi, welcome to Right Size Your Life. I'm Jenna Shimoleski with ERA Reardon Realty. I'm a seniors real estate specialist. And many times I've been on this show talking about all the different services that older adults and their caregivers can take advantage of. And we've talked about home care, and most people have heard about hospice. But have you ever heard of palliative care? With me today to discuss palliative care, I have Karen Johnstone from Heartland Hospice. Karen, thank you for joining us.
Hi, thank you for having me.
So palliative care is something that most people don't know. If they hear palliative, a lot of times they think the word hospice, and they can kind of complement each other, but you have a special program at Heartland. Can you share what exactly is palliative care?
Sure. So palliative care through Heartland, we call it Empatia Palliative Care. It's ran by a nurse practitioner that can go into a patient's home, but it is meant for any serious illness. So it may be a terminal diagnosis, but the prognosis may be longer than 6 months. So it really helps a patient navigate their symptoms. It's really meant for symptom management and some pain management that may coincide with that disease.
One of the things that people are so afraid of making that call to hospice is they think this is the end. And this is probably where a nice little bridge, would you say, to start bringing in caregivers, nurses, staff. Can you explain a little bit about that?
Yeah, so palliative care can coincide with home health care.
Okay.
So it doesn't interfere with their home health care benefit. It's just like seeing a specialist. So you may have a copay with that. Home health care, as you know, is typically covered 100% through Medicare. Hospice is typically covered 100%. Palliative care is just like seeing a specialist, so there may be a copay along with that. So our nurse practitioner can help with advanced care planning and goals of care. She can take a lot of time with that patient in their home, at bedside, reviewing their disease process and making recommendations to their primary care physician. So a patient does need to have a primary care physician in place so that the nurse practitioner has someone to consult with. So you don't need an order for palliative care.
Nice.
You can just call and ask for the assessment, and she'll come in and meet with them.
Oh, that's fantastic. I know that's another thing that frustrates people sometimes that they're transitioning to hospice, is that the medical director becomes, in essence, their primary care.
Sure.
But with palliative care, they can keep the relationship with their existing doctor.
Yes, yes. In fact, we want them to.
Awesome.
So we want them to keep their primary care physician. We'll work with that primary care physician. And the goal is to keep them out of the hospital too. We want to keep them home. So, and palliative care is shown to keep patients, the rehospitalization rate to less than 3%.
That's amazing. That's wonderful. So where do you provide? So you provide it in the home. Any other situations where you can provide palliative care?
Yeah, you can have palliative care in a skilled nursing facility. It won't interfere with your skilled days.
Nice.
You can have it in assisted living, wherever you call home.
Okay. And then how do you pay? You talked to potentially a copay.
Yes, it's covered through your insurance, most insurance plans. Unfortunately, we're not accepting Medicaid right now, but most insurance plans do cover palliative care, and it's just like seeing a specialist with your copays.
I love it. So Karen, with Heartland, can you share with us maybe an example of a specific situation where palliative care was the best option for a patient?
Absolutely. So we've had many patients with, CHF or a cancer diagnosis, and they're going through chemo. Dialysis patients, they're going to dialysis, but yet their symptoms are still a little bit unmanaged, and they just need a little extra care, another set of eyes and ears in the home that can help explain what they're going through. Maybe they've had new medications, maybe it's a new disease diagnosis, and she can help with navigating maybe next steps, treatment plans, and explained what they're going through, maybe a little more in depth, a little more time with them. But the main goal is to keep them quality of care at home and out of the hospital.
I love it, because nobody wants to be in the hospital.
No.
Wonderful. So if somebody wants to learn more about Empatia or palliative care through Heartland, how can they contact you?
They can call our office at 517-244-0404, or they can email me directly, karen.johnstone@heartlandhospice.com.
Thank you so much. This is such an unknown benefit out there, and if we can keep people at home, out of the hospital, and helping them to be educated a little bit more, I think this is just a great, great service for the community.
Give me a call.
Sounds great. Thank you, Karen.
Thank you.
And thank you for joining us. Again, if you have questions about palliative care, home care, or hospice, feel free to contact Karen with the number that she gave before. And if you have questions about overall right-sizing your life or talking about retirement communities, elder law, you need more resources, I'm here to help. Again, Jenna Shimoleski, Seniors Real Estate Specialist with ERA Reardon Realty. Thank you so much and have a great day.